the hidden anxiety symptoms in men you can't ignore. Your chest feels like it's in a vice, your stomach's on spin cycle, and you're running on 4 hours of broken sleep. You tell yourself it's just stress, maybe too much coffee. But here's the kicker. 1 in 3 men who land in the ER with chest pain are actually facing an anxiety disorder, not heart trouble. Society often tells us to man up, to tough it out, making us dismiss these crucial signals. Today, we're ripping the mask off the physical signs your body is screaming while your brain stays stubbornly silent. Section 1. Chest pain, the great pretender. That sharp left side pain showing up while you're just watching TV, it can feel identical to cardiac pain, can't it? The key difference, anxiety pain stays local, usually lasts under 10 minutes, and often fades when you pace or distract yourself. Harvard cardiologists tracked 750 male patients last year. A surprising 38% with clean angiograms met full criteria for panic disorder within 6 months. If doctors clear your heart, but that nagging pain keeps gate-crashing quiet moments, anxiety is almost certainly the more likely culprit. It's a master of disguise, this chest pain. Gut in a knot. Ever bolt for the bathroom before a big meeting? There's a reason for that. Cortisol and adrenaline, those stress hormones, actually divert blood away from digestion, triggering nausea, cramps, or sudden unwelcome diarrhea. In a 2023 survey of 2,000 men, a staggering 44% reported weekly stomach issues, yet only 12% linked them to anxiety. It's a classic misdirection. Try this quick check. Note if those symptoms mysteriously vanish on vacation. If they do, your entire GI tract is probably reacting to your thoughts, not just your lunch. It's the powerful gut-brain connection at work. Jaw, neck, and mystery aches. Clinch tests at dental offices reveal something telling. Men grind 30% harder when anxious, wearing down enamel and sparking tension headaches that often mimic migraines. That constant, low-grade fight-or-flight response keeps your trapezius muscles tight, so that dull ache you blame on the desk or the gym, it very often starts in the mind. Think of it as your body bracing for an invisible threat. Good news, progressive muscle relaxation for just 8 minutes before bed cut pain scores in half during a 2022 King's College trial. No painkillers needed. Exhaustion that coffee can't fix. Anxiety doesn't just keep you awake, it actually hijacks your REM sleep. You wake before that crucial restorative slow wave phase, leaving you feeling bone-deep exhausted the next day, even when standard blood work shows normal iron and thyroid. Here's a neat tell. You can still crush a workout at 6 p.m., proving your cellular energy is fine. Your nervous system is simply overheated, running on high alert. This chronic fatigue doesn't just drain you physically. It impacts your focus, your mood, and your ability to tackle daily tasks. Cutting phone use by 1 hour after 9 p.m. improved sleep latency by 22% in anxious males, according to a 2024 Oxford study. Anger outbursts hiding nerves. Let's be honest, society often trains us men to swap fear for fury. A sudden road rage spike or yelling at the printer often masks a cortisol surge, a body screaming, "Danger!" Partners, bless their hearts, usually notice this pattern before you do. Calm 1 minute, volcanic the next, then riddled with guilt. Here's the truth. Anger is anxiety's bodyguard. Once you acknowledge and label it, both can finally stand down. In therapy trials, men who actually named "I'm anxious" before reacting cut arguments with loved ones by a significant 35% within just 4 weeks. If any of these signs just snapped your life into focus, don't keep it to yourself. Drop a "same" or share the symptom that fooled you longest. Your comment helps the next guy feel less alone and tells the algorithm that, yes, men absolutely care about mental health too. Section 6, the 3-step reset plan. Okay, so what do we do about it? Here's your immediate action plan, a 3-step reset you can use anywhere, anytime. 1. Ground. Try a 5-4-3-2-1 sensory scan. It lowers your heart rate in just 90 seconds by shifting your focus to external, tangible facts. 2. Breathe. Use the 4-7-8 pattern. It drives your vagus nerve to release acetylcholine, effectively slamming the brake on adrenaline. And 3. Move. Do 20 jumping jacks or take a brisk walk. This metabolizes leftover stress hormones, so they don't just stew in your bloodstream. Use this powerful trio right there in the store aisle, the team meeting, or the driver's seat. No equipment, no stigma. Consistency is key here. Make it a habit. When to call the pros? Look, sometimes you can't go it alone, and that's perfectly fine. Seek professional help if these symptoms hijack your day for more than 2 weeks, if they pair with a sense of hopelessness, or if you find yourself leaning on alcohol to unwind. Cognitive behavioral therapy, or CBT, works for an impressive 60% of men within just 12 sessions, often without medication. Start with your primary doctor, ask for an anxiety screen, and remember this: requesting help isn't a sign of weakness. It's the same as bench pressing your mind, pure, unadulterated strength. Taking that first step is an act of courage. Conclusion. So, chest pain, gut trouble, mystery aches, dead tired mornings, and short fuse anger. These are 5 sneaky ways anxiety slips past the security guards of male self-talk. You're not weak. Your body is loyal, doing its prehistoric job of keeping you alive. Recognize the signals, test the reset plan, and please, reach out if that alarm keeps blaring. Share this with the buddy who keeps saying, "I'm just stressed." Hit like if you learned something new, and subscribe for more straight talk videos that keep your mental engine running clean. Let's break the silence and the stigma together.